Kenya has recently witnessed protests in the town of Nanyuki in Laikipia County, linked to a proposed United States-supported Ebola quarantine facility. This situation has attracted public attention due to tensions between local communities, security forces, and government authorities. Reports indicate that demonstrations escalated into clashes, resulting in arrests and at least one confirmed death during the unrest. To understand the situation clearly, it is important to separate the facts, the concerns, and the broader context. The proposed facility is intended to function as a quarantine and containment center for individuals who may have been exposed to Ebola while traveling abroad. According to officials, it is part of international health preparedness cooperation between Kenya and the United States. Authorities have stated that the facility is not meant to treat active Ebola cases within Kenya, but rather to manage exposure risks in controlled conditions. However, the project has raised concerns among some local residents and activists. One of the main issues raised is the perception of limited public consultation. Some community members feel that they were not sufficiently informed or involved in discussions before the project advanced. Another concern is related to safety perception. Although Kenya does not currently have an Ebola outbreak, some residents fear that hosting such a facility could increase perceived health risks or change how the region is viewed. There are also broader concerns about transparency, trust in institutions, and how international agreements are communicated at the local level. During the protests, law enforcement intervened to disperse crowds. In the process, confrontations occurred, and the situation escalated into violence. At least one person was reported killed, and several others were arrested. These events reflect a wider pattern seen in different countries, where public health infrastructure projects can become politically sensitive when community trust is limited. From an analytical perspective, this situation highlights three key issues. First, the importance of public communication. Large infrastructure or health projects require clear information sharing to reduce misunderstandings. Second, the role of trust between communities and authorities. Even medically justified projects can face resistance if trust is weak or unclear. Third, the intersection between global health cooperation and local governance. International agreements may be technically sound, but they still require strong local engagement to ensure acceptance. It is also important to understand that protests of this nature are often driven by a combination of factors, including social concerns, political context, and historical experiences with government projects. In conclusion, the situation in Nanyuki reflects more than a single project. It illustrates how public health initiatives, international cooperation, and community trust must align in order to avoid conflict. As events continue to develop, further information from official sources will be important to fully understand the situation. This report is based on available public information and aims to provide a neutral and educational explanation of the situation.